Hello, this is Krisha Hudson with another friendly podcast to you. I hope I'm finding you all happy and healthy. Let's talk about happy and healthiness in terms of thyroid and corticosteroid function. The thyroid, as you can see from your PDF, is in your throat. It produces two hormones, T3 and T4. I'm not going to pronounce those words. It's only too funny when I do. Um, but they're basically responsible for metabolism. You know, how it regulates how the body breaks down food and uses energy or stores it. So, metabolism is what the thyroid is there for. A little review for you in terms of hypothyroidism. Someone who has this condition, as Laura Taylor or your pathophys instructor has told you, they have slow metabolism. They feel very tired, mentally depressed, sluggish, interestingly, cold. They have weight gain and they have dry skin and hair and menstrual irregularities. And the simple answer to that is to give them levothyroxine. It's replacement. I read somewhere that this is the most common drug prescribed. Um, so, what do you have to watch with giving this drug? Well, you have to really watch it with pregnant women because they have a much higher metabolism. It is in pregnancy category A. You have to watch it with anyone who's older because they have decreased cardiac function. Um, and they might need a lower dose because it'll tax their heart. So anyone that has any sort of compromise, you really don't want to force uh, the heart to work harder and therefore tax it. Okay, so levothyroxine, it's treatment of hypothyroidism. It's absorbed very well through the GI tract. It's very cheap as a drug goes. The onset's kind of slow for the PO dose. You'll see maximum therapeutic symptoms in like 1 to 3 weeks, even though you know it's absorbed well. The onset IV is 6 to 8 hours. It's metabolized through the liver as everything excreted through the bile. What you really have to watch for as a nurse is overdosage. Okay, so you're going to watch for anxiety, nervousness. Tachycardia is a big one, especially with those that might have any cardiac compromise. Hypertension, another big one. Arrhythmias. So all cardiac issues. They may also have headaches, GI disturbances, and interestingly enough, heat intolerance. So, how do you monitor for this? Well, this is where the nursing intervention is really important. You need to get a really good baseline physical prior to starting therapy. So, knowing what their normal heart rate is and their normal blood pressure, EKG before starting would be useful. Other adverse effects with this drug is that it increases serum glucose, so getting a baseline glucose is good, and it increases the patient's response to sedatives. So, they may respond differently after they start this therapy, so you really have to watch them. Drug interactions with protease inhibitors because they're metabolized through the liver, warfarin, beta blockers because of the cardiac issues, as well as DIG. And it also decreases, surprisingly enough, it decreases serum DIG levels. Um, Okie dokie. Let's move on to the adrenal glands. The adrenal glands sit there on the kidneys. Um, in watching the adrenal glands, their main functions glucocorticoids. So, what do they really do? Well, your book does a really good job of talking about supraphysiologic and physiologic reasons to have glucocorticoids. A physiologic reason, just like with your thyroids, would be someone who needs normal levels of glucocorticoids. So it's replacement for someone who has adrenal insufficiency. Um, a supraphysiologic reason for giving someone a glucocorticoid is someone who has normal levels of glucocorticoids or steroids, and they need more of them. So, for instance, someone who suffers from asthma or COPD or arthritis or ulcerative colitis all needs the anti-inflammatory effect of a glucocorticoid. So they have normal levels of these, but they need more. Um, Someone who needs to be immunosuppressed, like someone who has had an organ transplant, they have normal levels of glucocorticoids, but they also need more. And someone who is at risk for preterm labor is another group. So, what do glucocorticoids generally do? Well, they have a main role in glucose metabolism. Um, um, they stimulate glucose metabolism and secretion by the liver. They also increase um, uh, liver sensitivity to glucagon and catecholamines. Um, they decrease glucose uptake and utilization by their peripheral tissue. Um, and they increase um, protein breakdown and synthesis, or to support gluconeogenesis. So um, it actually stimulates more free energy. Okay. Other things it does, it increase obviously it increases amino acids. It depletes muscle protein. Um, you will have a mobilization of fatty acids for energy. Um, it has its anti-inflammatory effects by suppressing prostaglandins and leukotrienes, anti-allergenic effects. So that's why you would use it for someone who has allergies. Immunosuppressive effects. It suppresses cell-mediated immunity, and it also reduces bone synthesis. So, okay. So, in looking at this, um, one of your objectives talks about the HPA feedback loop. Okay, so if you have any of these conditions, stress, pain, trauma, sleep, hypoglycemia, and your hypothalamus will release corticotropin, okay, which basically goes to your anterior pituitary and releases ACTH, and you get glucocorticoids in the form of cortisol secreted, okay, in response to these physiologic issues. Um, there'll be more cortisol available um, and circulating through your body. If you add synthetic hormones on top of whatever cortisol is circulating, your hypothalamus will read, "Gee, I got a lot of hormones circulating here. We don't need to make any more." So it sort of slows down, uh, you know, um, the body's production of glucocorticoids. So, what does that mean? That means that the body's no longer producing them because you're getting them synthetically. Hence, when you have someone on glucocorticoids, you don't stop them abruptly because your body's not making them anymore. So that's why we taper the doses at the end so your body picks up that production of making glucocorticoids. Very simple. The body recognizes what's running down the highway in terms of glucocorticoid and says, "Hey, we need to make some more." So we never abruptly stop giving glucocorticoids because of this HPA feedback loop. Okay, so your book also talks about adrenal insufficiency and adrenal crisis. Adrenal crisis is when you have severe hypotension, but you'll notice with adrenal insufficiency, um, you have hypoglycemia, anorexia, nausea and vomiting, flatulence, diarrhea, loss of mental acuity. Adrenal crisis is a little more severe because of the hypertension involved and the hypothermia involved. Adverse effects. If you look at your slides, you'll notice that acne is an issue. You'll notice thrush can appear because of glucocorticoids. I have a picture of the moon face in there, as well as you'll notice there's a first day picture of some boys, and glucocorticoids will make you hungry in ways that you never thought you'd be hungry before. When I was on them, I can tell you a wooden chair looked interesting for me to eat if I put a little salt on it. There's bruising underneath the lips. You notice the dark colored um, hands there. Gynecomastia, you'll notice in a man. There's this striae. So you can take a look at those pictures. Now, you have to watch because of glucocorticoids, caloric intake, and potential increase in protein. You probably want to increase their protein management. Timing the dose when giving glucocorticoids is really important. We talked about tapering or stopping the medication when you can. Um, um, this drug will cause GI upset, so you might also want to give it with an antacid. And for those that um, um, may need it, you may increase the drug during times of stress. Um, As a nurse, you're going to monitor for adrenal insufficiency, so that hypotension, hyperthermia is something you're going to want to watch. You're going to watch for the glucose, because remember, this will increase their glucose level, and it'll upset their electrolytes as well. And because it will immunosuppression, you want to maintain strict asepsis with these people. So washing your hands and keeping them from getting any sort of virus is very, very important. So with that, that is your summary of thyroid and drugs affecting thyroid function, as well as your corticosteroids. Have a great day.